everything. Thank you.
Thank you very much for this wonderful presentation. All theories with regards to trauma will be reviewed in the presentation, narrative therapy, imagination, everything was already dealt in her presentation. Thank you very much. Of course, delivery may be traumatic. It's not that rare. It is common, actually. Let me start with a couple of cases. 39-year-old woman with a daughter of 6 years old, and she is pregnant to the second child, and then she had very high anxiety, sleep disorder, and fear of delivery, because in the first experience of delivery she was mistreated by the healthcare professionals. 35 years old teacher in PTSD after a car accident, and for a very long time, even before the accident, she was diagnosed with generalized anxiety disorder. She was on treatment, and EMDR was administered, and then 10 years ago she had twins delivery, and emergency C-section was done, and the twins were in the ICU, neonatal ICU. One of the twins died, and she was very helpless, and she was accused by her mother-in-law, and then there was this maltreatment by the healthcare professionals. So there were those series of events, and then we tried to work on those experiences. We worked with EMDR again, and for the first time I did not fight with my daughter today in the last 10 years, she said. So from time to time she experienced these tantrums with her daughter, but for the first time she didn't. Another patient, actually they came for the couple therapy with the husband, and they had uncontrolled anger against each other, and he had 36, she had 36, and the husband had 24 as the BDI score. And she had sleeping problems, she experienced distress, poor energy, loss of libido, uneasiness, hopelessness, fear of losing her baby, diminished interest and pleasure, and she was always waking up at the nights and controlling her children and beating the eldest child. She experienced many complications after delivery. Spinal anesthesia failed, and then she experienced hypertension. She had this fear of stroke there, and then general anesthesia was administered, and then she had postpartum pain, and then pulmonary embolism developed. So she had this fear of not being able to breathe, vomiting at the 4th month, and then one night she caught her baby with asphyxia, and then she had insomnia, and she overreacts every time she hears her baby coughing. The EDI score is 36 and IESR score is 75. So we of course treated these people. The DSM of course needs exposure trauma in order to diagnose. Avoidance symptoms should be there, of course, and cognitive distortions and like negative alterations in cognition and emotion, numbness, hyperarousal symptoms. These need to be there, and that they have to last more than a month to diagnose. Anxiety, depression, like psychiatric disorders are more prevalent in women because the stress and traumas amongst women are more different based on relations primarily, and translational stress disorders are, women are more prone to this. pregnancy, delivery, and postpartum events may be important, and they might have an impact on the later courses of life. During labor and delivery, mother may be exposed to severe injury or death. Severe fear, helplessness, uncontrollable, and horror feelings may be experienced. Different figures, for example, in the prevalence is 1.7 in Sweden, it is 5.9% in Nigeria, and the mean, the average is 2%. When we look at the symptoms of PTSD, it is 34% in USA and it is 21.4% in the Netherlands. Modified perinatal PTSD questionnaire was studied to be, first of all, reliable or not, and then we worked on 158 women, and we found that it was 25.9% PTSD, and 70% of these cases also had depression. So we maybe have to check those postpartum depression cases if they also had a trauma history. Of course, PTSD prevalence decreases by time. In a month, it goes to, for example, 1.6%. It's a public health issue because those mental health problems have reflections on children. Impaired mother-infant relationship, delayed intellectual development, psychiatric disorders in children may result due to this condition, and if you cannot manage it, then in the later courses it might create more important problems. The cost of PTSD to society is substantial, and there are certain consequences like tocophobia, marital problems, job loss, social assistance dependency in Western societies. And if you can outreach these people at an early phase, then those problems can be reversed, those outcomes can be reversed. What are the risk factors? If there is high level of obstetric intervention, the risk increases. Of course, support is very important. If the mother can have adequate level of support, then PTSD after delivery, the risk of PTSD decreases. Feeling of powerlessness or helplessness during delivery also has an association with this PTSD. Labor induction or negative gap between severity of expected and experienced pain. Invasive interventions without informing the mother. Obstetric emergency. Do not care if they do not care about the women's emotional condition or mood. Premarital, unplanned pregnancy, history of sexual trauma, low self-respect. So they are all risk factors. Premature labor is also important factors because they result in loss, and they result in other healthcare problems in the child, and negative outcomes are there. For example, risk for motor and sensory impairment, learning problems, neurocognitive or behavioral problems, dyslipidemia, and hypertension. And when you also reflect all these conditions on cost, of course the cost is substantial, and they also create this condition also creates important psychosocial emotional effects on family, and they also have a burden or negative consequences on the relationships. And when we also study the preterm infant mothers, 67% of these mothers were diagnosed with PTSD, and it's only 6% for those that have full-term delivery. And preeclampsia, this is very important. It might manifest itself after the 20th week's gestation. This is high blood pressure and proteinuria. It is one of the most important reasons for mortality during birth. So women who have preeclampsia, they have PTSD very high. a very high level of PTSD. We are talking about always the mother, but when it comes to fathers, if there is traumatic delivery, the fathers are also impacted. Anxiety, PTSD, and depression are also prevalent amongst men, fathers as well. I have limited period of time, so I'll be fast. So we see that fathers are also affected. What do we do for treatment? Actually, there are not much of studies and nothing specific, and no specific treatment for this group of patients. The treatment regime can be the same for all the other PTSD populations. And there are new studies with regards to EMDR, and I think the other speaker will talk about that. So I think this is a very well neglected area in which we need future studies. Thank you very much.